We are safe anesthesia worldwide. The Lancet Commission on Global Surgery in 2015 estimated that 5 billion people have no access to affordable surgery and anesthesia. Most of them live in poor countries. Every 2 seconds, a person dies due to a condition that could have been treated or managed with safe surgical and anesthetic care. SAWR is a registered UK charity working to save lives and relieve suffering by improving anaesthesia services in poor countries. Anaesthesia is not a luxury, it is essential for safe, pain-free surgery. Anaesthesia is essential for surgical treatment of congenital anomalies or birth defects, such as cleft lip and palate. 94% of birth defects occur in poor countries. It's essential for treating burns that are very common in Africa, especially among children, because of the use of open cooking fires and kerosene cookers. Anaesthesia is essential for caesarean sections, needed to save the life of mother and baby when there are problems in childbirth. For example, obstructed labour is a major cause of maternal death and disability in poor countries. Anaesthesia is needed to treat injuries that result from accidents, natural disasters, or in conflict zones. SAWR aims to improve anaesthesia services by funding the provision of appropriate equipment, suitable education and training, and research to improve methods of anaesthesia in low-resource settings. SAWR supplies healthcare workers with appropriate equipment so they can care effectively for their patients. When donating equipment, it is essential to consider the end location and the limited resources available at rural hospitals in poor countries. These can be significantly different to the resources found at rich Western hospitals. For example, supplies of oxygen can be unreliable. Oxygen is an essential medicine. It's needed for anaesthesia and for treating patients in recovery. Oxygen is often supplied in cylinders that are expensive, difficult to transport, especially along the poor roads, and can run out. Power cuts are common, and mains electricity can be unstable. This can cause damage to sensitive medical equipment. Technical facilities and skills may be limited, so equipment needs to be easy to maintain and service. Low-resource settings need robust equipment that will work reliably in difficult and hostile conditions. Donated equipment must be fit for purpose. This means it must be compatible with the end user's skills and training. Bear in mind, in poorer countries, there are very few qualified doctors and other medical staff. It must be affordable to run and not need expensive consumables. It must be appropriate for the local infrastructure, for example, the electricity supply and medical gases that are or are not available locally. It must be compatible with local technical skills. It will not be possible to call out an engineer from the manufacturer, for example. This means It must be easy to service and repair. It must be robust and durable, and ideally sustainable. All too often, equipment sent to poor countries does not meet these criteria and is unsuitable or quickly breaks down and is abandoned in storerooms such as this. This is a tragic waste of resources. To avoid this, SOAR only supplies equipment that is suitable for use in any location. This photo shows anaesthesia equipment donated to a hospital in Somaliland. SOAR supports training for anaesthesia providers to improve knowledge, skills, and patient safety. This photo shows the graduating class in the Kagera region of Tanzania, where SOAR funded the first ever anaesthesia refresher course. SOAR also supports training for hospital technicians and engineers to help them care for and maintain crucial anaesthesia equipment. SOAR has supported award-winning research to improve methods of delivering analgesia and anaesthesia in low-resource settings. SOAR has donated anaesthesia equipment to 25 different low and middle-income countries in Africa, Asia and the Pacific that has been used to enable more than 25,000 procedures. We have donated equipment to improve the supply of oxygen in poorly resourced hospitals, saving patients' lives in hospitals in Liberia, the Gambia, and Uganda. We have donated portable anaesthesia machines that function without electricity or compressed gases for use following disasters in Nepal, Cameroon, and Syria. We have worked with numerous other organisations to improve anaesthesia and surgical safety. Wherever possible, SOAR collaborates with other charities and organisations to provide cost-effective assistance, avoid duplication, and make best use of funds. We have supplied specialist breathing equipment, CPAP, that is saving the lives of sick and premature babies in Uganda, the Gambia, the Democratic Republic of Congo, Somaliland, and more. We give hospital staff the correct tools so they can work effectively and with confidence. Investing in surgical and anaesthesia services is affordable, saves lives, and promotes economic growth in low and middle income countries. Please help us by making a donation today. Simply visit our website at www.safeforall.org.uk. Thank you.